Are you a swimmer that is trying to get back to swimming but has severe shoulder pain that's preventing you from doing it? This video is perfect for you. I'm Dr. Molly with Your Goals Physical Therapy, and I help swimmers get back to their favorite sport, swimming, despite shoulder pain. That's right, it does not have to be an ending event if you start to get shoulder pain and you love swimming. You don't have to change up your stroke. It is possible to get back to swimming at 100% with no deficits and no pain. That I help people all the time do that every day. It's amazing. It's wonderful. So most of the time, the conversations start with the people who come and see me. They are very nervous about what they did to their shoulder. They are nervous that they have to have surgery. They are nervous that they have to give up swimming forever. So I'm going to address those three things. First, let's talk about if we just talk about globally or the biggest reason why people have shoulder pain from swimming. It would be an impingement. And what is an impingement? An impingement is when your shoulder mechanics are not working in an ideal way and it is pinching on one of your rotator cuff muscles. Your rotator cuffs are there and they're designed to help you increase the space in your shoulder joints by pulling your arm bone down and then allowing for rotation. And it allows, you get 180 degrees worth of rotation, right? It goes all the way. So there's a lot of movement that your shoulder is responsible for. But because it is allowed to make such a big range of motion, there's a lot of room for error. Your spine affects, so if your spine is really stiff, that can affect your shoulder. If your shoulder blade muscles are not helping correctly, or the timing is off with your shoulder blade and your arm bone, that can cause a problem with the whole mechanics of getting your arm to go through that whole range of motion. For most people, and the reason I said 180 degrees is because we consider range of motion to be from your thigh up to where your ear is. And we all know that with swimming, we're trying to get the other end of that too, right? So you're trying to get as much motion out of that shoulder as possible. Again, that takes a whole lot of strength and stability. And if anything in that chain between your spine, your shoulder blade, and your arm bone are not 100% on point over time, that can wear things down. And our bodies are amazing at adapting. And so for many people, they'll create a new pattern on how they're gonna do things. And then again, over time, that can cause something else to wear down. That does not mean you have to give up swimming. Please do not hear that. It just means that something is annoyed at this point, and so annoyed that you're not able to ignore it anymore. So if you've gone to the doctor and they've given you x-rays, MRIs, or and cortisone shots or steroid pack, and you still have pain, please hold out hope, because that is frequently when people come and see me, is after they've had all of that, they've been told in some cases they need physical therapy, and in other cases that there's nothing that they can do for them, and to come back in a couple months if the pain doesn't go away. And in both cases, I have worked with people and they have gotten 100% back in the lanes, at the very least as fast as they were going before, and in most cases faster than they were before they came in to see me, because we're able to clean up that mechanics and able to clean up that range of motion. It's so much fun working with athletes. So we've gone over, do you need surgery? If the doctors tell you with the x-rays and the MRIs that you don't need surgery, by all means you don't need surgery. That means that they looked and they couldn't find anything that was torn that would need to be fixed. Now, if you're coming in and seeing me and we haven't had x-rays or MRIs, there are ways to determine that by strength tests and other special tests to determine if you need to have surgery. But most people who have shoulder pain truly do not need to have surgery. There is catastrophic events typically that are associated with people who have to immediately go to surgery without trying anything else. So So most of the people I see on a daily basis, even if there is a small tear, they never need to have surgery. So again, I hope that that is an uplifting message, that just because there's something going wrong with your shoulder, it does not automatically mean that you need to go have surgery. And I see people when they come in and they can't move their arm, it's annoyed, they're not able to sleep at night, they can't sleep on it or sleep on the other side because the shoulder's just so irritated. Motions, even just to their shoulder height, can be painful. Holding a cup of coffee can be annoying. So even with that significant level of discomfort, people do not automatically need to have surgery. So it's very rare if I'm working with somebody that I need to send them to go get surgery. So now, how do you get there the fastest? So if you're trying to do this on your own, I'm going to give you a couple suggestions. So if it's just slightly annoyed and you're not quite to the point of like agony all the time and you want to do this 100% on your own, then start working on shoulder stretches. Start working on spine mobility exercises. So anything that helps you bend and flex your spine to improve its range of motion. You need back strengthening exercises. And so in essence, if all you're doing to strengthen yourself is swimming, you need to broaden your horizons. You need to get out of the water and do land training and work on flexibility and mobility of your shoulder and your spine. Those are the big things that help specifically with shoulder pain. Now, if you want to get there fast without having to do tons of research on your own and trying to go down every rabbit hole on the best exercises for this and the best exercises for that, come and see a movement specialist like myself, because we can look at you as the whole picture. We can take a look at how your spine from your head to your tail is working and moving together, and make sure that that is not what's limiting your shoulder. We can look at how your shoulder blade and your arm are moving together. We can do lots of things to improve how all of that is coordinating, because it's amazing, again, with all that mobility and all that range of motion that your shoulder is able to do. It's very easy for one of those steps to be out of order and cause huge changes in how you're moving and make the mechanics in your shoulder go all sorts of crazy. And small changes can make a big difference in your range of motion, your overall stability, and when you get back into the lanes, how fast and efficient you are with all of those. In many cases, people who come in to see me for shoulder pain, they talk about how when they're trying to breathe, their neck on one side does not move as well as it does on the other. It's all connected. And so the fastest way to figure out what's happening with you and your shoulder is to have somebody else who does this all the time take a look at you, pinpoint exactly what's wrong for you, and help you create a specialized plan, which is what I'm here to help you with. If this is something that you're interested in, and you want to just call and chat for a little bit just to make sure, I offer a 20-minute free discovery session. We chat, we make sure that what you're trying to get back to is something that I can help you do. We get to meet in person, ask questions. Again, it takes about 20 minutes, and that's 100% free. It's just a way to kind of meet and greet and make sure we'd be a good fit. If you're trying to find things that you can do at home, more specifically for your shoulder, I have an ebook that has my best tips for how to solve neck and shoulder pain. Again, you really can't divide out the neck and the shoulder. They're so closely related that a lot of times a problem in one is hindering or making the problem in the other. So I will leave a link for that ebook, and you can download that and get those tips also. Well, I hope you're having a great day and that you get back to swimming soon. Bye.